welcome to the new members of the NVMA, Kira Kotz, Eric Post, Jacqueline Summer, Nicole Lenz, Nathan Dirks, Molly Dietrich, Jeremiah Johnson, and Nicole Bowers and Bailey Murphy. We just became aware of a new issue. We consider it the darting issue. This issue basically is the practice of darting cattle with a tranquilizer gun to supply them with medications when they are in areas that have no facilities, nor can they be worked in a safe manner. And seems as if the larger organizations have been discussing this. However, no organization has yet taken a stand on this issue. As the NVMA board, we would like to take some kind of stand on this issue, but there's more information that we need to have. And so we developed a task force that will be contacting our Cattlemen's Association. They're the ones who normally come up with the beef quality assurance guidelines, and we kind of want to know where they stand on the issue, if they're maybe coming up with guidelines. We will usually support the guidelines that they recommend, as we have in the past, but we just need to see where everybody stands on that first. Well, we've had a few members that have approached us as board concerned about the staffing levels for the laboratory. The laboratory is going to be increasing in size with the new facility, and there are some concerns by some people that there aren't going to be enough pathologists to do the work that we need to have done for the state of Nebraska. This can be a detriment to our veterinary community because we need to have some of those abilities to test animals for different things so that we can help prevent diseases. And there's a lot of other things, of course, that the pathology labs are used for, but that's probably the main one. If we have to send these out further to other labs, it kind of decreases the turnaround time. So we're concerned about that possibility. So what we're going to do is we already have a liaison committee that works with the university, and so we will have them look into the staffing issues. We do know that there are some plans of hiring some new people, but we were not given any specifics on that yet. And so we just want to look into the subject and see if there is a call to action for our NVMA board of whether we need to maybe write a letter to encourage the powers that be to make sure that they staff it properly. And if we can help with that, by encouraging them to do that, by mentioning how important it is to us as a veterinary community, then that's what we'll do. But we want to look into this subject just a little bit more. From the Prescription Monitoring Task Force, the members that we have on the board that are part of that committee, they have not been getting great reviews, and I think we as a veterinary community need to be prepared that how the bill is formed right now is how this bill will be applied to us. It's not a desirable thing at all, but this is the hand that we're being dealt. And so I think that's the thing to definitely be prepared for. There are a few things that we can still do, and in the near future be having our members go ahead and contact their senators so that they can logically tell their senators how this is going to be an undue burden on us as veterinarians. There's a lot of new information that we're finding out, and is definitely solidifying the case that this is going to be an undue burden, I think, on veterinarians. I don't know if that's going to make too much of a difference, but at least we'll have the information out there, and our senators will know then what the bill is truly going to be like.